Hi everyone, welcome back to my channel. If you're new here, my name is Neil Galve. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now. You hit the notification bell so that you will be the very first to watch my uploads. Also, don't forget to give this video a big thumbs up and share it with your friends because that will really help me know that you like to see more contents like this. Without further ado, guys, let's jump into the video. Hi everyone! Yes, another Monday discussion nga ang ali ko sa inyo for today. And I just want to wish you good morning, good afternoon, and good night just in case I don't get to see you. Like you see on your screen, today is all about pre-arrest algorithm. This is in line to my upload last Saturday, which I actually discussed the cardiac arrest algorithm in line with the AHA, American Heart Association protocol. Now, if you haven't watched that one, that was actually the very first time I created a live lecture for everybody, like spot on lecture. I actually discussed it. It's so juicy. It's so fun to like do something new for all of you guys, and I highly suggest for you to check that out because it's like kind of like do this. I had a previous discussion about bradycardia and tachycardia, SVT. So if you haven't watched that, I highly suggest for you to watch this first and then do the SVT and brady algorithm and then proceed with your cardiac arrest with a cardiac arrest lecture. All right, but I'm definitely planning to upload another lecture, a modified lecture regarding your sinus your bradycardia and stable unstable, and your supraventricular tachycardia stable unstable. So watch that out. But the very first upload was actually available like way few years ago. Nakalagay na siya dyan. So yeah, I'm just trying to update it for all of you guys. Like the same way I'm doing the lecture now. So if you like this type of lecture, type of discussion, the type of discussion that we're having right now, please let me know in the comment section below. Because what I normally do is like I do a presentation for all of you guys. If you like this type of lecture, you find it more entertaining and more active compared to the previous one, you let me know because I'm planning to do this type of lectures moving forward, all right? Where I can get to interact with you and record myself live. O, diba? Gusto nyo yon live na live. Okay, magpo-proceed na tayo ha. This is going to be the pre-arrest algorithm of your American Heart Association. So I'm gonna give you the things that you have to remember pre-arrest phase. Okay, so this is in a hospital setting. All right, let me correct myself. On my previous video, I actually used the term pre-arrest phase, pre-arrest setting, which means I actually mean pre-hospital phase. The cardiac arrest algorithm I discussed last Saturday was in hospital setting. That was not a pre-hospital setting type of arrest algorithm, all right? Because you need to use the defibrillator, you have access to, you have 5 compressors available and stuff. So that is just what's this? Hospital setting. This is also going to be in a hospital setting. Don't worry, because for today I am going to teach you everything that you need to do, the things that you have to remember when it comes to your pre-arrest algorithm. Ano nga ba? What are the things that you have to do before you arrive to the or in your attempt not to go to the arrest phase? All right. On the cardiac arrest algorithm, we discussed the 4 deadly rhythms. That is your VTAC and VFib, which is under your shockable rhythm, and the non-shockable rhythm, which involves your asystole and PEA, pulseless electrical activity. So this is the things that the nurse provider, the doctors, should have to do together in order not to arrive to the cardiac arrest phase. All right, you don't want to go to the deadly rhythms. And these are the things that you have to do as part of your pre-arrest algorithm according to your American Heart Association. I will introduce you to this concept of, all right, let me start here. Concept of what? Vomit. So you will hear this, vomit. Let me change something here for you. The way we're gonna do this is by, I will introduce to you to an acronym, which is VOMIT. All right, let me change that color real quick. Put that here. All right, VOMIT. So I want you to remember this abbreviation, you guys, because this is going to be the sole focus. This is where all of your pre-arrest algorithm will be all of the pre-arrest algorithm actions, and and what's this interventions is going to be it's going to be included in this abbreviation. This is actually an abbreviation. This is not an action word. This is not nausea and vomiting. This is vomit, an abbreviation that we use, that I will going to use in order for you to remember the pre-arrest algorithm easily and faster. All right. So each letter stands for something, and we're going by each letters one by one. All right. So let's start with the first, V. V stands for three things. Hold on a second. Told you this is live. O, diba? Ang saya. Vomit. Wait lang. Huwag yung excited. Vomit yan ha. Hindi pagsuka ha. V stands for... What does V stands for? Any ideas you have in mind? Sa mga nag-aaral dyan for ACLS. Ano to? What does V stands for? It actually stands for three different things. The first one is, V stands for, hindi ako makapagpatuloy. Saglit lamang. So let me just change this one up real quick. Better that color. Okay. So V stands for visualization. Visualization. Ano pa? Vital signs. Ano pa? V stands for verbalize. Pag narinig mo yung V sa vomit, nasa pre-arrest tayo, wag malilito. You have to, V stands for visualization, vital signs, verbalize. What do I mean by visualization? In visualization, you guys, you have to visualize these following terms or these following things in your patient. Remember that there's an acronym, stands for CBC. Visualize the following, CBC. CBC stands for visualize for the consciousness, the level of consciousness of your patient. May altered level of consciousness ba tayo? What is your baseline GCS? Is your patient responsive to, is alert, responsive to pain, responsive to sound, or pain? Mga ganon. Consciousness. B stands for breathing. Okay. Breathing. What are the normal parameters of your breathing? Is it effortless breathing, or the patient, you can see accessory muscles being used? You can also visualize if there's no flaring of nostrils. those kind of stuff. Ano bang itsura ng pasyente mo? Hapong-hapo ba yan? Visualization of breathing. Alright? Because the normal value for your breathing, it should be effortless. Alright? Once you see any effort, exertion, during breathing of your patient, that's one of the key terms, indications that you have to put on your assessment, nursing assessment, in terms of your breathing. Now, color. CBC, consciousness, breathing, color. In terms of color, the color of the skin, the general appearance of your patient. How does she or he looks like? As your patient looks pale, bluish, cyanotic, yellowish, baka may jaundice yan. The general appearance of your patient in terms of color of the skin, color of the nails. This is a perfect indication for hypoxia for certain patients. So we're done with the first V, which is visualization. Malinaw ba tayo doon, you guys? Malinaw. Very good. Now, what is the next V? Nasa vomit pa rin tayo, ha? V. V stands for vital signs. In terms of your vital signs, there are three, there's an alphabet that you have to follow to make your life easier. It's A, B, C, D, E. Okay? Huwag malilito. Ito tayo. Usog ko lang siya ng konti dito para magkaroon tayo ng space. Okie doke. Alright. So, in terms of vital signs, what did I tell you? You have there an abbreviation. Hold on. Let me adjust this real quick. Oh, what did I do? Let me adjust this one. Oh, let me adjust this real quick for your convenience para maganda ang notes natin. Okay? Visualization. There tayo. Alright. Vital signs that involves your A, B, C, D, E. Isa-isahin natin. A stands for airway. Ito na nga lang natin to ilagay. Airway. B, C, D, E. Okay. Usog natin siya dito. Okey-doke. Alright. So, vital signs, ano mga assess mo? Airway, breathing, circulation, disability, exposure. Okay, mag-alala. Bibigyan ko kayo ng mga idea dyan. Sa airway, ano i-check mo dyan? Siyempre, yung patency ng airway mo. Airway and breathing, magkasama yan. Airway and breathing. Ano yung mga i-check mo sa airway and breathing? You would check for your respiratory rate. Sige na nga, lagay ko na lang dito RR. RR. Ano ang i-check mo pa kasama ng airway and breathing aside sa patency ng yung airway? Baka may mga blockage dyan. Tingnan mo. Ano pa? O2 saturation, O2 sat. Nurses, it's important for you to know your normal values. What is the normal value for your respiratory rate? 10 to 12 cycles per minute. O2 saturation, what is your normal value? That is 98% above. More than, ayusin ko nga yung penmanship ko. Sorry naman. More than 98% above. Depende pa rin to kung may COPD ang pasyente mo. Pag COPD ang pasyente, ano yung mga acceptable nating what's this? O2 saturation. Ano, nurse? Sagot. Kayo dyang nakikinig lang dyan. Charing. 88% above. Okay. Ayun tayo. Malinaw, malinaw. Airway breathing, huwag kayo mag-alala. Nasa vital signs pa lang tayo. C stands for circulation. Very good. When it comes to your circulation, what are the key important things that you have to know? That is your pulse rate. Your pulse rate and your blood pressure. All right. So, you guys, maaaring nagtatanaka kayo. Sa pre-arrest setting, I am actually teaching you the key points, the key nursing assessment points that you have to have on your notes, that you have to have on your assessment in your patient. These are the things I'm teaching you, a systematic way, a systematic approach from cephalocodal approach po tayo dito. In terms of how are you gather information in relation to your patient's current condition. Now we're done with visualization. You all know that in terms of visualization, you're using your assessment skill, which is sense of what? Sense of sight. Okay? So, circulation, but you're gonna check your pulse rate and blood pressure. Normal pulse rate, you guys, sumagot, 80 to 100 beats per minute. That's why it is very important for you guys to know your normal values. Why? Because that's the time that you will be able to identify if the patient is beyond the normal value or less than the normal value, and that's when you're gonna be alert that there's something wrong with this patient. Blood pressure, the ideal is 120 over 80 according sa ibang book millimeters of mercury, but in American Heart Association, blood pressure more than 80 over 60, that's they considered stable. Any blood pressure less than 90 over 60, that is unstable. That's actually one of the key indicators on how are you gonna manage bradycardia and supraventricular tachycardia, the blood pressure. All right, blood pressure, the level of consciousness of your patient. Those are the terms or the parameters that you can say if your patient is having stable bradycardia or unstable bradycardia, unstable supraventricular tachy, or stable supraventricular tachy SVT. All right? So, malinaw tayo dito. Ito po ay based saan? Sa AHA. Ano daw yung penmanship ng natin for today's video? AHA. AHA guidelines. Okay, hindi ko yan guidelines. Guidelines yan ng AHA. What is D? Disability. Ooh, hold on a second. D stands for disability. In terms of disability, ano bang titingnan mo kung ano-ano dyan? Dito, disability ba to yung mga physically challenged natin pasyente? No. Ang disability natin dito stands for, may another acronym, okay, mag-alala, AVPU. Okay, this is one way of checking your patient's level of consciousness. Okay, AVPU is an abbreviation that stands for alert, verbal, pain, and unresponsive. Unresponsive. So as you can see, this is actually, when you talk about disability, you're talking about the level of consciousness of your patient. There's one way, there's abbreviation that you need to follow. Is your patient alert? So, A tayo. Is your patient responsive to sounds or verbal cues? V tayo. Is patient responsive to pain or totally unresponsive? That is your disability. Now, the last abbreviation under your vital signs, the things that you have to include in your vital signs, you guys, ay ito. E for exposure. Oh, sorry po. E is for exposure. Let me write that here. Wait nga, paliitin ko nga to. Para maganda yung notes natin. Nakikita nyo pa rin, hindi ba? Nakikita nyo pa rin. Okay. So, E4, unresponsive or unresponsive exposure. In terms of your exposure, under pa rin tayo ng vital signs ha, wag malilito. Baka nalilito kayo dyan, nanggigigil ako sa inyo. Oh. Okay na, happy? Exposure, you will check for any signs of trauma or body temperature. Okay, that's one of the things that you need to rule out in your assessment. Vital signs, that includes, recap lang tayo, vital signs, that includes your, what? That includes your airway. That includes your A, B, C, D, E. Each letter have meaning. Airway stands for, A stands for airway and breathing. Sa airway and breathing, what are you gonna check? You will check your RR, your auto-saturation. For circulation, you will check for the following: your pulse rate and your blood pressure. Sa disability, that's actually assessing your level of consciousness. You will have your abbreviation AVPO. Alert, verbal, pain, unresponsive. Sa exposure, you will check any obvious signs of trauma and your patient's body temperature. Alright? So, nasa V pa rin tayo. Huwag kayo malilito. Papalakihin ko lang tong V para sakop niya. Happy na ba tayo sa V? Happy na tayo sa V na to. Ang laki, oh. O, diba? Ang saya. So, that's V. The last V is what? Verbalize. I-highlight ko lang to. O, diba? Last V is verbalize. Anong i-verbalize ng pasyente mo? O, may acronym na naman. Dito ka nakukuha ng secondary history taking mo. Don't, mind you guys, that this all happens simultaneously, okay? Hindi naman to yung step by step. This is actually step by step, but this could occur simultaneously. This could overlap according to the necessity of the situation. According to certain situations. But by following this rhythm, this algorithm, you'll be able to have like a structured a structured methodology in how you're going to approach certain things, especially in this type of scenarios when it's really urgent and there's a lot of things, there's chaos. Sabihin natin ganon. In the situation, the last thing that you want to do is magkalat ka. You don't want to mess up. So let this be your guide in making sure that you're not missing out in any particular or pertinent information regarding your nursing assessment. Pre-arresto, this is all about taking history taking while administering early intervention to your patient, because again, you don't wanna move towards the arrest phase of the cardiac arrest algorithm. All right, so ito siya. Verbalize. Ano-ano ang verbalize mo, guys? Meron na naman tayo ditong acronym. O, di ba? Meron tayo ditong tinatawag natin, nag-iisip ako. Meron tayong, narinig nyo na to sa history taking, sample. Sige nga. Sample. O, diba? Sample. Hindi po showtime. We're not talking about a noontime show, but we're actually talking about an abbreviation, sample, which is an effective tool for nursing assessment. Sample stands for, the S in sample stands for signs and symptoms. Okay, in terms of signs and symptoms, how are you gonna ask this? How are you feeling? Can you tell me more about what you feel? Just like that. I'm gonna give you an example question which you can actually ask to your patient. How are you feeling today? All right. A stands for allergy. You need to rule out any allergic reaction. Any known allergies to food or medications? That's how you're gonna ask your patient. Kapag alert ang pasyente mo. Next is M for maintenance. Maintenance. Medication. Is your patient receiving any maintenance antihypertensive medication on chemo medication or ano pa ba mga tinitake, anti-lipid or asthmatic patient, mga ganon. You have to ask, are you taking any maintenance medication? Okay. And then P stands for past medical history. You have to search for any possible causes of your patient, of the current situation of your patient, past medical history, any hospitalization in the past, family history, yung mga ganon. Those are the things or the information that is included in your past medical history. Ano pa? L stands for last meal. What was your last meal? What time and when? Okay? What time and when? Paulit-ulit tayo. The time and what is the meal of your patient before this incident happened. Next is your event. Event. O baka umattend ng dibu ang pasyente mo. Charing. No. Here's how you're gonna approach this question or get this information. What were you doing before this happened? Or because you want to rule out any precipitating factors, this could be like the patient is having a panic attack or the patient is having an argument with his wife or her girlfriend, those type of things. That's why you're showing supraventricular tachycardia, yung mga ganon. So you want to rule out any precipitating factors, any events that happened previously that can cause your patient to suffer from his current condition. Again, this is full guidance on your history taking. V stands for verbalize. This is you asking to your questions or asking your questions to the patient or significant others. S stands for signs and symptoms. A, allergy. M, maintenance medication. B, past medical history. L, last meal. E for event. Again, that is your what? Your sample. Alright? Malinaw ba tayo sa V ng vomit? Malinaw tayo dito? Very good. Okay, malinaw tayo dyan ha. Now we're gonna proceed with your next abbreviation, which is going to be, oops. Hold on a second. Put that here. Okay. Di ba ang ganda? O, take ang screenshot ka na. Very good, very good. Next, we have your O. What does O stands for? Vomit. O stands for oxygen. Oops, sorry. Pa talaga pag live, no? Oxygen, oxygen, oxygen. All right. So, the earliest thing that you want to give to your patient is what's this? O2 therapy. But not just the typical O2 therapy, okay? So what you're gonna do is you will base it based from the information that you given to your patient. Any problems in the breathing, which is or you already rule out in your vital signs taking and your visualization and exertion in the breathing, that is now the time that you will give you will give early intervention to your patient. That is by giving oxygen. Vomit. O stands for oxygen. Now, there's some things that I want you to remember in starting O2 therapy to your patient. What are the common oxygen therapy that we administer to our patients? Sagot. Charing. We have here your nasal cannula. Nasal cannula. We also give oxygen therapy through face mask. Okay? We also give it through a non-rebreather. Rebreather mask. Okay. Now, ano bang pinagkaiba? What is the difference between the two? The difference between these three. Well, in terms of the differentiation, the maximum percentage of oxygen that they can give to your patient is the one that matter, and also is the one that makes them different. No doubt. And then the level of oxygen that you can give to them, it depends on your desired goal. For nasal cannula, you can give it through what? How many liters? 2 to 4 liters per minute. For face mask, you guys, you can give it around 6 to 10 liters per minute. For non-rebreather face mask or mask, you can give it around 10 to 11 to 15. 11 to 15 liters per minute. So as you can see, as you go down, pastaas ng pataas, the numbers of liters per minute of oxygen that you're giving to your patient is going up. That's the trend. Meaning, as you use the non-rebreather mask, as you move from nasal cannula to non-rebreather face mask, the demand of oxygen that your patient needs is higher. And of course, you already evaluated that because you check the auto-saturation, you check the respiratory rate. Remember, you have to assess first, and V is very important because it will matter what type of intervention you are going to give. That's why I always said this to my nurses. Nursing assessment is the one of the skills that you have to master. And let me tell you, nursing assessment you will not just get it from the book, but the best teacher of you harnessing your nursing assessment is by practice, exposure to area. That's why don't be scared if you're you're a first timer in the area, you're fresh grad. It's your first time to handle this type of patient. Go do it. Go do it. Ask questions. A lot of questions, okay? Because there's no such thing as stupid question for me, all right? If you ask certain question one time, it's okay. But the next time, you should be able to stand on your own. Okay? Malinaw tayo dyan? Malinaw. I was planning to do this discussion really, really quick. But I'm seeing the time, it's 33 minutes already. So I'm sorry. But this is like a thorough discussion of your AVPO. Vomit na tayo, ha? AVPO of your vomit. So vomit na tayo, ha? Okay, so we're done with B and we're done with O. Of your vomit. Now we're gonna proceed with your M. M stands for, any idea, you guys? Sagot. Huwag kayong parang ako lang yung sasalita dito, charing. Ano yung M? M stands for, so kung kanina nagbigay na tayo ng oxygen, paunang therapy sa iyong pasyente, ano na yung next mong gagawin? You will do M. M stands for, dito na tayo, ha? Wag malilito you guys, nasa ano pa rin tayo, pre-arrest algorithm. And vomit is your pre-arrest algorithm, okay? So, M stands for, monitor. Oh gosh, stomach. I just finished my dinner, so that's why. So, M stands for monitor. What are you going to monitor? That's the question. I-monitor mo ang baon ng katrabaho mo. Charing. So, in terms of monitoring, what are you gonna do? Normally, kapag nasa pre-arrest phase, gumagawa sila ng pre-hospital. Pre-arrest ako ng pre-arrest. Pre-hospital setting, what they do, lagay ko nga dito. Pre-hospital. Sa pre-hospital setting, they monitor the ECG or the cardiac activity of your patient using 3-lead ECG. Okay? So, bibigyan kita ng indication. Monitor, indication ng trick. Okay? Depende yan kung nasaan kang scenario. Kung nasa pre-hospital setting ka, normally nire-require may 3-lead ECG. Pag nasa hospital setting ka, meaning naka-admit ang pasyente, could be ICU or ward or ER, hospital setting, the standard 12-lead ECG. Matik yun. Ngayon, kung di mo pa napapanood, if you haven't watched the lecture I created about how to take ECG, nursing, and that's under nursing procedure and skills, I'll be putting the link on the description box, or whenever the icon button pops out, click the one out because I'll be putting it there too. All right, so we're done with M, that stands for vomits. Vomit. We're done with M, that stands for monitor. So tapos na tayo sa VOM. Nasaan na tayo? We are now going to move to your I. I stands for, any idea, you guys? I stands for intravenous access. IV access. IV access. Syempre, you will be anticipating that you will give medication to your patient because nasa pre-arrest ka na nga eh. So you have to have an access already. Kung nasa hospital setting to, i-check mo kung may IV line. Kapag bago namang admitted ang pasyente mo, swiruhan mo na. If nasa ICU ka, internal, critical care unit ka, you might want to check what type of central line, if there's any central line accessible to you, or accessible to your patient. You might want to check the patency of it, all right? Because anytime you're going to use that one to administer any medication, ACLS medication to your patient, okay? Now, a clue lang when giving and when starting an IV line, peripheral line ha. Nakakalimutan kasi natin to. Peripheral line should always be in your what? The biggest vein, which is preferably your right and left, right or left or right antecubital. Of your patient's non-dominant hand. Nalala nyo si Kushir? Sinabi niya to doon. Non-dominant hand. Alright. So, we're done with your pre-arrest setting actually. Because the T is for, sorry po. The T is, sorry po. What am I doing? We're done with your pre-arrest setting. The T is actually for treatment. That is now the time that we are going to discuss about your bradycardia and SVT. So that is I'm planning to give it or to put it in a different discussion because I actually created one already previously, and if you want to go there, I specifically discussed to you the treatment for your bradycardia, stable, unstable, and then SVT, stable, unstable. Okey-doke. I actually created a separate discussion regarding the treatment of your Brady and your SVT. Check that one out or abangan mo. Kung gusto mo ng latest discussion ng yung Brady and SVT, I'll be uploading another video, a new and fresh video regarding bradycardia and SVT, stable, unstable. Alright? But once again, ang bilis lang, di ba, ng yung pre-arrest algorithm. Tatandaan mo lang lagi yung acronym mong VOMIT. You have to remember this one. VOMIT. Para hindi ka naliligaw. I-brush up natin. Pre-arrest algorithm, your first thing in mind is you will think about the acronym VOMIT. V stands for visualization, vital signs, verbalize. In terms of visualization, you will check the consciousness, the breathing pattern of your patient, the skin color of your patient, general appearance. Vital signs, what are the things that you will include in your vital signs assessment? A, B, C, D, E. Airway, breathing, magkasama yung dalawang yan. So what you will going to check, you will check for your respiratory rate, which is 10 to 12 cycles per minute. Autosaturation, which is greater than 98, or sa ibang libro, 96%. Okay? Depende yon kapag COPD ang pasyente mo because more than 88 is acceptable. Circulation. What are the things that is included in your assessment of your circulation? Pulse rate and blood pressure. Alam mo na yan, 80 to 100, normal blood pressure, pulse rate or beats per minute. And what's this? Blood pressure ideal is 120/80 millimeters of mercury. If you're going to follow the American Heart Association, they actually say 90/60 above is stable blood pressure. 90/60 below is considered unstable blood pressure. Disability, what are you going to check? You're going to remember this phrase or this acronym, AVPU. A stands for the alertness of your patient, verbal, pain, unresponsiveness. AVPU, disability. You will check the exposure, part pa rin siya ng vital signs mo, A, B, C, D, E. Trauma and temperature. Any signs of trauma, bleeding to your patient, internal, external bleeding of your patient. Body temperature, you will rule out hypothermia and hypothermia or hyperthermia. Alright? Hindi pa rin tayo nawawala. We're still under V, which is verbalize. This is now the time that you will take your secondary nursing assessment. Sample is the term or the abbreviation. S stands for signs and symptoms. A, allergy. M, maintenance. P, past medical history. L stands for last meal. And E for event. Any precipitating event that causes your patient to have palpitation. That's what you want to know. You want to rule out every single thing. All right. We're done with V. We're now going to proceed with your oxygen. This is now the time that you will give early nursing intervention by giving administering autotherapy. There's 3 things that you can use: nasal cannula, face mask, and non-rebreather mask. Nasal cannula 2 to 4 liters per minute. Face mask, set it to 6 to 10 liters per minute. If you're using non-rebreather face mask, you will set it to 11 to 15 liters per minute. Keep in mind the acceptable autosaturation for your patient. Alright, vomit, vivava, M. We're down to your M. M stands for monitor. This is your baseline ECG taking. Alright, monitor. Pre-hospital setting, you will need 3-lead ECG as your baseline ECG reading. Hospital setting mo, magbabago yan. You will do the standard 12-lead ECG reading. Vomit. I stands for IV access. You have to have an IV access in preparation for giving any intravenous medication to your patient. Peripheral line, you have to remember, choose the largest vein. If you have central line, that's even better because you don't have to think about inserting an IV line. But for peripheral line, you will use the right and left antecubital depending on your patient's non-dominant hand. Non-dominant hand, according yan kay Kushier. O, diba? Para naman nakakagalaw pa rin yung pasyente mo. Treatment. Sa treatment naman, vomited. Treatment. This is going to be a separate discussion. Huwag kayong mag-alala kasi magpo-proceed na tayo noon sa susunod nating lecture. Or kung hindi ka na makapaghintay, I actually discussed or create a lecture regarding your bradycardia, stable, unstable, and SVT, stable, unstable. That was way like 1 year ago, I believe. But I will definitely make an additional upload regarding your bradycardia and SVT. May mga bago tayong update doon. So, once again, thank you so much for listening today. I hope you learned something. You guys, this is your pre-arrest algorithm. I hope naging madali sa inyo natandaan itong mga bagay na to. Let me just adjust something so that you will have an easier time to make a screenshot and add this or make it as your reviewer. Saglit lang. Adjust ko siya. Happy ka na ba dyan? Happy ka na? Happy. Saglit lang. Oh. Ay, sus. Okay. So, this is your vomit, which is the way for you to approach your pre-arrest algorithm in line with your American Heart Association. Thank you so much, you guys, for joining the class for today. I hope you have a great day. Tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sira, ang pinakabago, pinaka-fresh at pinaka-libreng nursing review center sa balat ng YouTube. Don't forget to follow me on all my other social media accounts. Everything is at Neil Galve, except for my TikTok account, which is Neil Galve Official. And do me a favor, give this video a like, just so I know that you guys are having fun and learning something on my lectures. I love you guys, and you have a good one.